Welcome, everyone, to today's exploration of a less common, but important, topic in cardiovascular health: lipomas in the heart. While we often associate heart disease with plaque buildup and blocked arteries, this condition involves the growth of fatty tumors, called lipomas, within or around the heart. Join us as we delve into what causes these growths, how they affect the heart, and what can be done about them. The exact cause of cardiac lipomas remains largely unknown, making it somewhat of a medical enigma. They are generally considered benign neoplasms, meaning they're non-cancerous growths. In most cases, they appear sporadically, without a clear hereditary link. However, some researchers believe genetic factors or pre-existing conditions might predispose individuals to developing them. Obesity, while a risk factor for many cardiovascular diseases, hasn't been conclusively linked to the development of cardiac lipomas. More research is needed to fully understand the underlying reasons these fatty tumors form in or around the heart. The pathophysiology of a cardiac lipoma depends largely on its size and location. A small lipoma might cause no noticeable disruption. However, as it grows, it can begin to compress or infiltrate surrounding heart tissue. This compression can interfere with the heart's normal function, potentially affecting its ability to pump blood effectively. It can also disrupt the electrical conduction system, leading to arrhythmias or irregular heartbeats. In rare instances, a lipoma can even obstruct blood flow through a major vessel if it's located near one. The degree of functional impairment directly correlates with the size and location of the lipoma, influencing the severity of symptoms. Cardiac lipomas are considered quite rare. Reliable epidemiological data is limited because many lipomas remain asymptomatic and are only discovered incidentally during imaging for other conditions or during autopsy. Precise incidence and prevalence rates are difficult to establish due to this often silent presentation. They appear to affect men and women relatively equally, and they can occur at any age, though they are more commonly diagnosed in adults. Given their rarity, large-scale epidemiological studies are challenging to conduct, highlighting the need for increased awareness and better diagnostic methods. The signs and symptoms of a cardiac lipoma are highly variable, ranging from completely asymptomatic to severely debilitating. Many individuals with small lipomas experience no symptoms at all. However, as the lipoma grows and begins to interfere with heart function, symptoms may start to appear. These can include shortness of breath, chest pain or discomfort, palpitations or a feeling of skipped heartbeats, fatigue, lightheadedness, and even fainting. In severe cases, the compression can lead to heart failure. The specific symptoms experienced depend on the location and size of the lipoma, as well as the overall health of the individual. Diagnosing a cardiac lipoma typically involves a combination of imaging techniques. An echocardiogram, which uses sound waves to create images of the heart, is often the first-line investigation. However, more detailed imaging is usually required for a definitive diagnosis. Cardiac MRI, or magnetic resonance imaging, provides excellent visualization of the heart's structure and is particularly helpful in differentiating lipomas from other types of cardiac masses. Cardiac CT, or computed tomography, can also be used. Finally, in some cases, a biopsy may be performed to confirm the diagnosis and rule out other conditions, although this is less common due to the invasive nature of the procedure. While there aren't strict classifications of cardiac lipomas based on specific subtypes, they are often described based on their location: epicardial, intramural, or endocardial. Epicardial lipomas are located on the outer surface of the heart. Intramural lipomas are found within the heart muscle itself. Endocardial lipomas are located on the inner lining of the heart. This location plays a significant role in how the lipoma affects heart function and influences treatment decisions. Understanding the exact location is crucial for surgical planning, should intervention be necessary. The treatment and management of cardiac lipomas depend on the presence and severity of symptoms, as well as the size and location of the lipoma. Asymptomatic lipomas may only require regular monitoring with imaging to track their growth. For symptomatic lipomas, surgical removal is often the preferred treatment. This can be performed through traditional open heart surgery or, in some cases, through minimally invasive techniques. The goal of surgery is to completely remove the lipoma while preserving the surrounding heart tissue and function. In rare instances where surgery is not feasible, medications may be used to manage symptoms like arrhythmias or heart failure. Because the exact cause of cardiac lipomas is unknown, there are no specific preventative measures that can be taken to completely eliminate the risk. Maintaining a healthy lifestyle, including a balanced diet and regular exercise, is always beneficial for overall cardiovascular health. Early detection through routine check-ups and prompt investigation of any concerning symptoms can also help in managing the condition effectively. While we can't prevent them entirely, Proactive health management is always advised. The prognosis for individuals with cardiac lipomas is generally good, especially if the lipoma is small, asymptomatic, and detected early. Surgical removal is often curative, and most patients experience significant symptom relief after surgery. However, the long-term outlook depends on factors such as the completeness of the resection, the presence of any underlying heart conditions, and the individual's overall health. Current research focuses on identifying potential genetic markers that could predispose individuals to developing lipomas. Advanced imaging techniques are also being developed to improve the accuracy of diagnosis and surgical planning. The rarity of the condition means research is ongoing, but advances are constantly being made to improve patient outcomes.